love running. I love running.
So there's a very common entity that occurs on the toes of an individual's foot known as a corn. There's two types of corns. There is a soft corn, which occurs in between the toes, which is 100% of the time caused by footwear that squeezes the toes. And what ends up happening is, if you look at the shape of the toe bones, they're hourglass shaped. So they're narrow in the middle and wide at the joint surface. So a corn is caused by one of the wide joint portions of one toe rubbing up against the wide joint portion of another toe. So that's typically known as a haloma molly or a soft corn. Very common location in between the fourth and fifth toes, because most people's shoes do that. Hard corn locations popular on the end outside part of a toe. Again, shoes squeezing it. They can become very painful. Traditional conventional therapy is to trim them off with scalpels and have the patient come back as often as they develop. Worse yet is to not educate the patient about the footwear, make an incision on the top of their foot and take out bone or smooth bone. That's the traditional approach. Natural preventive conservative approach is to encourage the individual to not allow anything to cause the toes to rub against themselves, as is the case of a soft corn, and not to allow the shoe to rub on the outside part of the toe, known as a hard corn. Another very popular location for callus or corn tissue is on the inside of the big toe joint, because the abductor hallucis muscle is trying to pull the toe out, while simultaneously the shoe, the tapering toe box of the shoe, is trying to push the toe in. So corns can be cured almost 100% of the time by understanding that the toes are not meant to contact each other. They're meant to have appropriate spaces in between them. And if we allow for that, we can actually see corns go away permanently.
I love running. I love running. I love running. I love running.